So the very first thing you'll notice as you log into PracticeSuite is that it's a web-based application. You can use this on any operating system, whether that's Windows or Mac, with any kind of browser, Safari, Edge, Google Chrome, or Firefox. In terms of best performance, we recommend Google Chrome, as that seems to work the best with the PracticeSuite software. Now, once you arrive on the homepage here, you will have your own personalized dashboard. This dashboard is based off of your user role. So, if you're a billing administrator like myself, you'd have a workflow very similar to this. If you're just a front office scheduler, someone that should not have access to some of the financial data you see here, they would not have something like this pop up. So at the top left here, everyone will have their own to-do list. So throughout the system, you have the opportunity to go ahead and create follow-up actions like following up on claims, maybe touching base with a patient about a statement or a question that they had about a balance they owe. Down below, you see a couple of pie charts here. These are going to allow you to go ahead and see at a high level how many claims have gone accepted, rejected, what's gone no response, maybe what's on hold. On the far right-hand side, how many charges we've generated, total payments. We're able to see adjustments, denials. And if you'd like to change these, you can come to the little drop down here and select what period of time you want to see this. We can even look down at the bottom right, see our aging here. So able to get a sense of what our aging looks like. If we see a problem area, like here on the far right-hand side, a lot of aging over 180 days, we could drill into that a little bit more using the top right here. So at the top right, we have our favorite KPIs, and a KPI stands for a key performance indicator. This is going to allow you to go ahead and select your favorite metrics that you want to see. So if I click on the little gear here, I'm able to go ahead and see different metrics around denied claims, claims that are about to expire, follow up, AR, no response. So we're able to go ahead and take a look at those. And on the right hand side, you can star or favorite the ones that you want to go ahead and utilize. Now, once you've indicated those, they're going to pop up right here. So say if I want to drill into that insurance aging that I saw at the bottom, I could click right here on my summary insurance aging. And what that will pop up is broken out here at the bottom left here, the name of the insurance, how we billed that insurance, how much was billed out, how much has been paid so far in the given period of time, what's been adjusted off, and what's left outstanding. Now, most systems out there are going to stop right where it says outstanding. So that's going to only give you an idea of what the aging looks like. It doesn't necessarily tell you how much you're going to collect. So, one way that we differentiate ourselves is by looking at the estimated payment. That's going to allow you to load all of your contractual fee schedules into our software. By going ahead and doing that, you can see truly what is the estimated amount we should be collecting. That way, you'll have a better gauge on what's outstanding, what you expect to collect. And then on the flip side, if you're ever underpaid for any reason, which on average you're underpaid about 7 to 11% of the time on all of your claims, that's going to allow you to go ahead and check for that. Using that estimated payment, using the variance report in our system, you're able to verify all that information. Now, navigating around our software is very easy to do. Over on the left-hand side here, you can see our navigation menu. So speaking to security here for a second, you can not only restrict what menu someone has access to, but you can also restrict what submenus someone can access. So if I were to go into charges, for instance, we look at our submenus here, you can also go ahead and restrict what submenu someone can access within here. Now, in terms of security, because this is a web-based system, we not only will restrict someone by the menus they can access or submenus they can access, but we will also restrict someone by time and date access. We will also restrict them by IP address. Now, that's a huge thing with any web-based system or cloud-based system. You don't really hear about a lot of them that can restrict by IP address. So let's say if folks should only be accessing this software, within the confines of your office, you can actually restrict someone to only be able to access it within the office right there. So moving along here, I'm going to go ahead and click on our scheduler. And going ahead and bringing our scheduler up, we have a resource-based scheduler in our calendar. So essentially what that means is that a resource could be a provider like Dr. Hamilton and Dr. Howard that we have right here. A resource could also be a room of some type. So we have a lab here on the far right-hand side. We could also have a piece of equipment that we schedule for, like an ultrasound machine or MRI of some kind. Now, navigating through our scheduler is very easy to do. Let's say if you want to move an appointment, say drag and drop Jenny Jefferson over here. you could go ahead and click on the appointment and drag and drop them over here. So we could bring them over and say if they need to come in later or if they need to be seen by Dr. Hamilton, we can go ahead and do that. Now, say Daisy needs to do the same, we can drag and drop them over here. Now, say Dr. Howard has an emergency, they need to step out for the rest of the morning. Just on the fly right here, you can right click, go ahead and click on create break or off time. So we're going to say they're going to be out of office. And we're going to go ahead and say they're out of office till 12. And when we hit save, it's going to go ahead and create that block right there for us. Now, in terms of our scheduler, we do provide some automation. We have text and email reminders that can go out to patients up to 1 day in advance. At the bottom left here, you could also click on a patient. So say if we go ahead and click into our appointment in here, we also automate around eligibility verification. Now down here at the bottom left, you're going to see 3 green check marks, and that's because our patient has 3 insurances, and of those 3 insurances, every one of them has come back active. Now, if something was inactive, it would have a red X there. So that red X would indicate that it came back with inactive coverage, would also indicate that it was not able to verify the information. So for instance, we didn't type out the information correctly. Now, if someone were to come in same day or they're a walk-in, you can also check eligibility on demand over here on the far right-hand side. So by selecting check eligibility, that'll bring up our eligibility window here. And if you were to check someone on demand, here's an example of what an eligibility would look like. So you can see the patient's information right here. And if we select the benefit information here, you have the ability to go ahead and see what services they have in network. We can see what the co-insurances are by the different types of visits, co-pays by different types of visits, deductible, we can see what's been met towards the year, what's remaining. And as we kind of continue to scroll down, we'll also have the ability to look at any limitations, out-of-pocket costs, or different coverages that they have. Now, bear in mind, this is all based off of the insurance. You're not necessarily going to get this back with every single insurance. Some are better than others. So in some cases, you may only get back active and $25 copay, and with others, you may get back that level of information that we just showed you. Now, the other thing within the appointment scheduler, you have the ability here to go ahead and view what you need to collect from the patient today. So we see that we have a $25 copay there for the patient. And if the patient had any balances over here, previous balance, we can see if the patient had anything they owe us. Now, to collect that money from the patient, right here on the far right-hand side, you could click on New Payment. And that's going to bring up our payment window here. So we're always going to default our payments here to copay. You could also come in and select a different payment type for reporting purposes if you'd like to grab that. So the amount is defaulted here for copay. You could change that. Now, if it was cash or check, you could go ahead and indicate that. If you want to select credit card, you can just enter that it's a credit card payment and save it. However, you also have the ability to go ahead and process payments within our system. So this would allow you to swipe a card and take the payment. You could also enter in the card and take the payment as well. You could save that card on file for future use, and that way if the patient comes in the future, you could just use that saved card to go ahead and take the payment. So we do offer the merchant services integrations. You can reach out and ask if what the cost would be for that, and we'll be happy to go ahead and answer that for you. So not only does it save the card on file, but something we recently just released are payment plans. So if you'd like to go ahead and have a payment plan created for the patient, say collect $500 broken out into 4 payments of $125 over the next 4 months, you can set that up, and the card would get charged every single month. So that's our scheduler. Kind of continuing to move on here on the left-hand side, we're going to go into the patient area. So if we bring up our patient record here, I'm going to go ahead and bring up an established record in our system. And as we bring up our patient record here at the top right-hand side, you're going to see that patient alert pop up right away. Now, throughout the system, you have the opportunity for alerts to pop up. So these could be patient-related in nature. These could also be related to front office or back office mannerisms that the patient may have. These can pop up in the patient area, in the scheduler, in charges, so you can have those pop up in various areas of the system. Now, over on the left-hand side, you'll see the patient has a picture there. You can snap a photo of them using any kind of webcam or upload a photo. You'll see here under the demographics tab, all of the standard patient demographics are here. So for top to bottom is all of the patient's demographic information. At the very bottom here are the patient's insurance policy information. Now, over on the left-hand side, you could add a note about the patient. You could take a payment, say calling in over the phone. They want to make a payment towards their statement. You can go ahead and take that over the phone. You could verify eligibility for that patient or even put in an authorization. So related to authorizations, if you needed to simply just track the authorization number, you could go ahead and bring this up and just put the payer name and the auth number here on the left. You could also put how many visits are allowed. So if it's visit based, you could put how many visits are there. The system will track how many have been used so far, and it will alert you when there's a certain amount remaining or less. You can also do your authorizations based off of CPT code and put how many available units are allowed for that CPT. Now, within the patient record, you could also scan or attach documents directly into the patient's record. This could be a driver's license or an insurance card. View the scheduling history of the patient, to be able to see future and past appointments for one individual patient, or even bring up their statements. So, say if you're bringing up that statement history, patients calling in about a particular balance they have, you could generate the statement that you sent them and follow along with them. So, related to the statements here, you can see the statement, scroll down here, and be able to look line by line and kind of explain from left to right what the patient owes, what the balances are on the right-hand side. And then as you scroll down here to the bottom left, you can see if there's a co-insurance amount there that's related to the remark code we're seeing here in the third line and the fourth line. Now, you can print and mail your statements yourself. We do also offer print and mail services through our clearinghouse that do come at an additional charge. Now, continuing through here, we've looked at our patient record, and it's time to enter charges into the system. Over on the left-hand side, you'll see where it says charges. And to start entering our charges in, we'd come right here to enter charges. So if we go ahead and put in enter charges, now if you manually are entering charges, on the left-hand side, this is where it's going to bring up all the patients on the calendar today. So all of the patients are listed out there. It creates a really nice and easy list for you to be able to go ahead and enter your charges into the system. So if you click right here, it's going to populate the patient, and you'd be able to go ahead and fill in the billing information here. Now, as far as the diagnoses go, you could start here by entering in your diagnosis. So if you know your diagnosis, you could just type it in and tab your way through. If you needed assistance, we do have this ICD-10 lookup tool. And this is going to allow you to go ahead and select your favorite ICD-10 codes. You could select a 9 to 10 crosswalk search, just do a general ICD-10 search, or look up by an ICD-10 index. So you'd be able to use any of those if you'd like. Now, if we just go ahead, and we're going to go ahead and select one right here. And we'll go ahead and add that to our charge. As we tab our way through, we can enter in our CPT codes. Now, you can manually enter in your CPT codes one by one. And as you notice, the fee is populating here in the amount field, and that's coming from your fee schedule. So if you have a second line of service, third line of service, you can go ahead and manually enter those in. And if we go ahead and take those out from there, let's say instead of doing that, I want to create some kind of a shortcut. So rather than having to add each line one by one, I could create a shortcut code. So I could come here to the first line, and let's say I'm just going to type in a shortcut code I've created. And if I hit enter, you'll see 5 lines explode out. So rather than having to add each one manually one by one, I could do that right there. It could even be set up to put a modifier on my primary line. So you can do that and set that up. It's called a code macros or a shortcut code. Now, if you do repetitive billing, meaning your patient is coming in every single week for the same reason, rather than having to type anything in or use a shortcut code, kind of up here to the top right, you can see something called copy last charge. If you go ahead and select that, it's going to copy everything directly from the previous visit, and it's going to drop that right here into the system for you. Now, down below, under additional information, we can add something like a referring provider right here, authorization number, say we want to manually add that on. In the conditions area, we can go ahead and select a condition, so an admission date, maybe an accident-related thing for work comp, personal injury, lab information, and under the Others tab, you could add a claim note or say a supervising provider if need be. Now, down here at the bottom right, you see that there's an option to save. And when you save this, you can either bill this to the primary, you could put it into a hold status, so you can kind of decide what you want to do there. And once you're done, once you hit save, that's going to go ahead and save the charge. But if you look right here, you're going to see a validation pop up. So we go ahead and scrub these charges for you. So for instance, if this comes back with any errors, in this case, we have a CPT code that is not matching what should be there, which is 5 alpha character numeric characters, as far as the setup there for a CPT code. So that's an invalid CPT code. If we want to correct that, we could just click right here. It's going to bring up an edit charge screen where we'd have the ability to go ahead and make the corrections necessary. So we can see that maybe there's something wrong here as far as how we've set up our CPT code. So kind of moving through the system here, if you are an integration customer, so that means you are having your charges imported in from a third party, like an EHR, a RIS or PAC system, or a CRM of some type, you're going to work through a little bit of a different workflow. So rather than manually having to enter in your charges, you can go here to the left-hand side, go to charges, and you're going to go to super bill. So by going to charges in Superbill, that's going to go ahead and bring the charges in directly here into our charge master. Now, again, if you want to know about which EHRs, risk impact systems, or third parties that we integrate with, you can go to practicesuite.com/partners, and that will give you a list of all the folks that we integrate with. Now, within the charges here, you'll notice all of the patients listed out here. So each blue line represents a different patient and a different claim. So if we go blue line by blue line, we can see all of that information. Now, this is going to default by patient last name alphabetical order. If you would like to filter this differently, you could click right here. And this is going to allow you to filter by specific patient, by CPT code, dates of service, provider, insurance, so you can set up whatever filter you'd like from that perspective. Now, as we start here with patient Tammy Cochran, we can see from here that Tammy has their date of birth information listed there. They have United Healthcare. Next line down, they were seen by Dr. Hamilton. Here are the 4 diagnosis codes we have listed out here. Just to the right of that is the place of service code and the service location. And then the last line here is the actual date of service with the CPT code. Now, if we notice something wrong, like say one line up, I see 4 diagnosis codes, but just one pointer is listed there. So if I double click right here, it's actually going to bring up an edit for that line. So I could come in here, I could add my other diagnosis pointers, or if I wanted to add a modifier, here's modifier 1, 2, 3, and 4. I could add a modifier here as well, and I could just hit update to go ahead and update that information. Now, if it's more than that, let's say we're missing diagnosis codes, we're missing CPT codes, we just need to fix a lot of stuff on this. Over to the right-hand side, there's this edit charge button. Now, if you go ahead and select the edit charge button, that would bring up our full edit charge screen like we saw with the validations a second ago. Now, within here, you could come in, you could add additional diagnosis codes, additional CPTs, void out CPTs, and once you've made your corrections, you're going to hit save and come right back to this list. Now, when you're done with this, over to the left, we see the little checkbox right here. You could just check this off and move on to the next one. Now, if we look at some of these other ones, you're going to notice that Gertrude and everyone else have red lines, exclamation points, caution signs. So if you click on any of these, just like we saw with the manual charge entry, this will actually have validation errors that will scrub as soon as they come in from the EHR side. So you can see what those are by line, by encounter level. If we had a duplicate charge created here, we can see any of those errors that kind of pop up. Now, once we're done working these, we can, again, check them off one by one. We can check them off at the very top left and check them all off. Down here at the bottom right, there is a green process button. So if we go ahead and select that green process button, that's going to put these in a bill to primary status. You could also put these on hold if you want and put them into a hold status initially. So once we go ahead and hit process, our next step is to go ahead and submit our claims out. So if we go to charges and we go to submit claims, that's going to bring up our claim submission area, which is our claims workbench is what we call that. So I'm going to filter this to just bring up a little bit of rejection information. So this is essentially the front line of how you submit your claims. So the front line would be how I send my claims out, how I work anything that's rejected from the clearinghouse, from the payer. All of that will come back right here. So the very first thing you're going to see is this interactive pie chart. And if you go ahead and click on something like I want to see all my claims on hold, this is actually going to bring up all the claims in a hold status. And if you click into the date of service, you could look and see what the additional detail is related to that. Now, over here at the top left, if you look at where it says ready to submit, this is kind of like a inbox format. So if you think about your email, Outlook, Gmail, you have the different little inboxes or folders. And then to the right, it's telling you how many emails that you have to look at. Now, in this case, these aren't emails, these are claims. So if we start here at ready to submit, we actually have 4 claims that are ready to be sent out. So as far as these claims go, at the top, you could filter these by date of service, by provider, by legal entity. Otherwise, what you could do is at the bottom right, if you don't want to filter them, you just hit generate batch. And once you go ahead and do that, again, it's going to bring up those validation errors and warnings. It's going to give you one more chance to go ahead and go back and fix these. Otherwise, if you don't want to fix them, you could just hit proceed with claim generation. And what that's going to do is take those 4 claims, it's going to put them in a batch, and it's going to have it ready for you to go ahead and send out. So if we now move from batch and go to unsubmitted batches, this is where our batches are. So over to the far right-hand side, you see the little send button. And by hitting send, that's going to immediately send it to our clearinghouse, which is TriZetto in this case. One thing to note is when you hit send, it is going to instantly send that batch to TriZetto. So a lot of systems, when you batch and send something out, they don't send it until later that night. So we don't do that. As soon as you hit send, it's going to fire that off. Now, once you've done that, all of the statuses, all of the messages from the clearinghouse are going to come right back into the PracticeSuite system. So over on the left-hand side where you see electronic claims, all of those are going to get filtered into accepted, clearinghouse rejected, payer rejected. So if we click on accepted, for instance, over on the far right-hand side, you can see the claim status. So you can see where it was batched and sent out. The clearinghouse received it, the payer received it, any responses or acknowledgments from the clearinghouse or payer are all listed out there, which is great. But more important than that are going to be the things you need to fix. So clearinghouse rejections, when we click on that, this is going to show all of the claims that came back as rejected from the clearinghouse. Now, if you go ahead and press the plus button here, this is going to give you what exactly the clearinghouse rejected it for. Now, as this is a demo account, you're probably not going to necessarily see a super valid reason there. But to correct this, let's say, for instance, this is demographic related. So we weren't able to find the subscriber information. So maybe it's a guarantor. If you click on the patient's name, so if we click on Rochelle Foy, this will go ahead and bring up Rochelle's demographic record. And once it brings up Michelle's demographic record, you can come down, you can make the changes. Maybe it's insurance related. And once you've made those changes at the bottom right there, there's a save button. So when you go ahead and hit save, that's going to save that information, and it's going to bring you back right back here. And you could check off the box and move on to the next one. Now, if you notice here, kind of up to the top, just one thing I want to point out is right below the blue bar, there's these tabs: submit claims, patient, scheduler, home. And that's because just like your web browser, when you open something up in PracticeSuite, it's going to open up another tab. So you'd have the ability to never lose where you are. You don't have to leave here, go somewhere else, come back again. You're always going to have that same spot that you're in before. Now, if we click our next one here, and let's say this is claim related, not demographic related, we could go ahead and click on the claim number. So if you do that, that's going to bring up our edit charge screen. So again, we can make the corrections necessary here. We can hit save. Once we do that, we come back here again. We can check that off. We can check these off one by one as we work them, or we could just check them all off. And if we check them all off, what we would do here is at the bottom left, there is a rebill and generate claim button. So if we go ahead and click on that, that's going to rebill and that's going to generate our claim right from there. Now, payer rejections are similar in that they are frontline rejections. They're not denials. This is when the clearinghouse forwards it onto the payer and the payer rejects it. You're going to work those the same way that you're going to work the clearinghouse rejection. So they're no different. You can click on the claim number. You can click on the patient. If you ever have a paper claim you need to generate and it drops the paper, you can come right here. You can check off the ones that you want to print. And at the bottom right, you just select the print button, and that's going to go ahead and print off that information. Now, the last thing you're going to notice here is where it says clearinghouse and there's a launch button. So we are firm believers in transparency. While all of the information is going to flow back into PracticeSuite, you can still log into the clearinghouse. So we have a transparent login that's going to allow you to click in here and log in directly to the clearinghouse portal. Now, as far as clearinghouses go today, we do offer clearinghouse integration with TriZetto, like you see here. We also offer integration with Relay Health. So those are two clearinghouses that we offer with our services. We do also have another dozen or so clearinghouses we're integrated with, where we can allow you to submit claims or download the batch or be able to upload it manually. So if you prefer to keep your own clearinghouse and pay for it separately, that's a possibility with our system as well. So now at this point, all of our claims have been sent out, and we are at the point where we're going to get some kind of notification from the insurance. So if we go to payments and we go to ERA posting, all of your electronic remittance advice is going to automatically download directly into the PracticeSuite side. And so if you go ahead and say click on one of these remits, this is going to bring up all the details specific to that remit. So we're able to see who the patient is, what codes were billed, what was allowed, what was paid. You can see what was adjusted off. And then if you hover right here, it's going to tell you why it was adjusted off. And if the patient owes you extra money, you could see why the patient owes you extra money. You could see if something was denied, this is the reason it was denied, and then any remark codes related to that. Now, if we click on the post button here, that's going to go ahead and bring everything up. So now everything gets copied over, everything gets filled out for you, really nice and easy. And then the system will take whatever the next action is. So as far as the next action goes, if this patient has secondary insurance and this was a primary claim, when you come down and hit post here at the bottom, it's going to create a secondary claim. And just like we did that whole process a second ago on the previous screen, you're just going to batch and send out that secondary claim electronically or on paper if the secondary doesn't offer an electronic connection. If it's Medicare's primary and Medicare has auto-crossed this to the secondary, these lines are going to be highlighted purple up here. And then once you hit post, the system will update the status has already been sent to secondary. If it's now patient balance, it will say bill to patient. When you hit post, it's going to transfer the balance to the patient. And now you can generate a statement for them. Now, one thing I want to point out, there is a setting in PracticeSuite you can turn on that will auto post those patient payments for you when there's a balance and an unapplied payment that's sitting out there for the patient. So essentially, you can either set it to do a date for date match, or you can set it where it takes the oldest unapplied payment and applies it to that patient balance. You can also turn that setting off yourself and manually apply those payments if you'd like. Completely up to you. Now, one last thing I want to point out here, if you do see one pink line, that pink line is because that claim is denied. So it was allowed 0, it was paid 0. We highlighted it pink just to emphasize that it was denied, and it's easier for you to see that. Now, you don't have to do anything special there. You still want to post that denial. What happens essentially is that anything that is denied, anything that gets no response in our system, it all gets pulled into a very useful tool called our collection manager. So the collection manager, especially from a billing perspective, this is one of the most important modules in our entire system. So this helps you work all of your denied claims, all of your no response claims, and all of your open lines of AR. Now, why that's important is because on average per MGMA, 33%, so 30%, I'm sorry, nearly 1/3 of all of your claims come back as either denied or no response from the insurances. And they say that of that, 30% or nearly 1/3, typically 66% of that is never collected on. And the reason that is because you either A, just don't have the bandwidth and the manpower to be able to work those claims. You may also just not have tools that are as helpful as this to be able to organize everything. So if I were to click on denials and hit search, the system is going to query the entire database for us here, and it's going to find all of the open denials. So it's going to categorize them here on the left-hand side by denial code. And to the right of that, it's going to give a short description of what that denial code is. Now, before we click into those at the very bottom right here, we can see we have total of 10 denied claims, just over $9,000 outstanding. So if I were to click on one of these right here, down below I have every single patient from every insurance that's denied by that reason. So I can see a Cigna patient here, I can see an Aetna patient. If you look over to the far right where it's in red, so this is actually going to sort these by oldest date of service to newest. So if I were to click on this patient right here, everything you would need to work this claim is right here on one screen. So at the top, we have all the patient's information. At the bottom, we have the claim information. So the 2 lines that were actually denied. At the bottom center, we have all the activity that was ever done on this claim. So on the far left-hand side, we have time and date stamped. On the far right-hand side, where in the system and who created this charge, who sent it out, any changes you made, um, all of that information, all that activity is all listed out right here. Now, if you rather filter that by denial history, so here's all the denials we've ever received, here's all the follow-up history, so all the notes we've done, the claim history, we can see all that right there. Now, over on the left-hand side, if you need to adjust something, I could click on the demographics, and it's actually going to go ahead and bring up the demographics right here. So you can make the corrections necessary and go ahead and hit save. You can also check eligibility from here. You can update the insurance information. Now, let's say if this was claim related, I could click on the charge master. This is going to bring up the edit claim screen. So if I needed to make changes here, I need to make this a resubmitted code. So now instead of an original claim, this is a replacement of a prior claim. I could add my reference number right there and hit save. Let's say you need a letter for appeal. We can load appeal template in here. And so with that appeal letter, you could have that generate for you right here, and you could print that off. Now, once you're done with that on the far right-hand side, you can document what you did. So if we go ahead and put in our notes, let's say 7 days from now, we're going to go ahead and put this information in, and I'm going to remind myself, so I'm going to assign it to me and say follow up on claim. So I can move this into a pending status, and then a way for you to track your collector productivity is to go to sub status and go ahead and say claim resubmitted. So now when you hit rebill and batch, it's going to rebill, it's going to put your claim back out there. So as I mentioned, you can repeat this process for all of your denials. You can do it for no response claims, but you could also use this as an AR report. So let's say I want to go to all open lines. And if I go to more here, you can filter by specific payer, by specific provider, or come here and say, I want to filter by date of service. So we not only have date of service, but we also have last claim date. That would be the date that you first generated the claim. So let's say you have a 1-day lag. This would have a different date than your date of service. We also have a filter for last filing date, and that's what that LFD means. So that means every time you've refiled the claim, it will re-age it for you. So what I want to find here is all my claims 90 days and older. So if I go ahead and hit search right here, it's going to go ahead and search and bring up that information for me. And so now it's going to categorize it by the name of the insurance. So if we come right here, you notice the insurance names. So it has, for instance, Aetna. We have quite a bit here. If we click, it has all that information. It's again on the far right-hand side sorted by oldest date of service, but I can go through and work these one by one now. Now, if I want this as a report that I actually want to show, I can come here to the top right-hand side. There's this little Excel button, which would actually allow me to export this as an Excel report and utilize that if I'd like. So the last section of the system I want to show you is related to reports. So if we come to reports here, this is actually going to bring up our report central. So our report central has over 100 reports. They're all categorized here, as you can see, scheduler. We have financials on the far right-hand side, and that's actually our largest section of reports. We have a dashboard section, charges and payments, and aging. So some of these have gold stars next to them, as you've noticed. So if you actually click on your favorites right here, once you star those, it's just going to bring up your favorite reports. So it makes it a little bit easier to look at when you go ahead and bring those up. Now, just to give you some report examples, one thing about our reports is you can filter all of these. So you can filter them within the software. So if I were to click into one of these, for instance, I can filter them by date, by provider. You can also export any of these reports. So let's say if I want to bring this report up, and this is our system financial summary report. If we go ahead and bring this up and say hit search on these, this is actually going to show me just at a very high level production for each individual provider. So over here on the left-hand side, we can see the name of the provider. You'll notice it says master demo practice here, but down below it says optometry. So if you have multiple tax IDs or multiple facilities, you can actually list the production for each one right here. So from left to right, here's the provider. Here's the charges they generated in the period of time we ran this report, total payments they generated, total adjustments. We can see how many payments they have in a unapplied status. That's what on account means in our system. How much net AR, meaning what AR was added or removed under that provider's name. We have total AR here and a number of procedures they did. Now, right up here to the top left, you can see you can export any of our reports to PDF, Excel, and some of them will actually export out to CSV. So that's one example of just monthly production by provider. Let's say at the end of the day, you want to grab those payment reports. So you want to understand what the front office staff collected. So if I come in here, we could come into our payment deposit report. I'm going to go ahead and filter this here. And let's say instead of grabbing all the payments that the billing team posted and the front office team posted, I just want the front office. So if I go to payment collected by, I could just click on front office and hit search. And that's actually going to bring up just all the payments that they collected. So it's going to show who the patient was, what type of payment, is it co-insurance, is it copay and a deductible. We can see how much they collected in check, how much they collected in cash and credit card. So it's going to show it line by line. At the very bottom here, though, it's going to show the total in check, in cash, in credit card, how much of it was left unapplied, how many refunds that we have. So you can review this all right here at the end of the day just to make sure all the good money got collected. And then over to the top left again, you can export this to Excel or into a PDF as well. So just a couple of the reports I'll show you. If you are wanting to have a reconciliation of your appointments and charges, just to make sure that there is nothing missing. So whether you're using an integrated partner or you're just using our billing software, if you click right here and go ahead and pick an appointment date. So let's say we're going to pick today. This is going to go ahead and bring up all of our appointments. We can confirm that the patients, are in a checked out status. Now, when charge created says yes, that means that the charge was either created in PracticeSuite manually or it crossed over from an integration partner. When billed says yes, that means that your billing team billed that out to the clearinghouse. So when all these say yes, that's great. And the one at the very bottom, we can see that there's an X, and that means nothing was created as far as a charge goes and nothing was billed out. So then we can follow up with our providers if we're using an integration partner, or we can follow up with our billing team and understand why a charge wasn't entered in. So the last section I want to show you right here is our dashboard reports. So this is a combination of reports that is going to give you a lot of data, but it's only in an Excel format. So it's a combination of actually multiple reports that can get pulled up here in a format that would bring that up for you. Now, I already happen to have one of these on my desktop, so I'm just going to go ahead and bring one of those up here. But just to look at the executive dashboard, which is the one I'm going to bring up, you can actually come in here and filter it. So let's say we want to bring up what date, what providers, and you can pull up that information as you'd like. But as I mentioned, the dashboard reports only generate in an Excel format. So if we go ahead and bring that up, this is going to go ahead and bring up that information for us. So if we look here, what the actual executive dashboard is going to show us is going to be a 6-month rolling summary of our data. So 6 months back and up to today, this is going to bring up that information. So over on the left-hand side, you can see we have gross charges, average lag days, gross receivables, cash receipts, co-payments. So we have all this information here. And then from left to right, we can see totals. So what did we collect for 6 months? And then month over month, what did we collect? So what you're looking for here is trending analysis. You want to see how you did over a month period. So here's everything for November, here's for December, January, February, March, all the way over to April. Now, if we looked at gross receivables, for instance, we could see that November was healthy, December we took a big hit, January we improved, we doubled in February, and we continue to improve March to April. And that's a positive trend that you want to see. If you come down to the next section, we have appointment data. So as far as the appointment data goes, you can see how many appointments you had by status, and then month over month, how many appointments there were in total and in what status. The idea is you want to see everything in a checked out status, obviously. But what you can also gather from this is cancellations, is no-shows. So if you see a lot of cancellations and a lot of no-shows, that might be an opportunity for you to create a cancellation or no-show fee. And that way you could levy a charge onto your patients for not showing up. Down below, you can see the receivables. So for the last 6 months, these are the insurances to the left, the totals that you received for 6 months, and then month over month, what did you collect for those? So this is kind of in a data view. So these are just the hard numbers. If you're more of a graphical person, you could bring up a graph view here. So this is going to show all the charges, all the average lag days, your receivables. So it's going to show all that information for you in a really nice format. So definitely check out our dashboard reports. They are really great. So they'll take a combination of maybe 4 or 5 different reports and put those all into one really nice, clean format. So that's everything as far as our demonstration today. We really appreciate your time. If you do have any questions, more than welcome to reach out to us directly. You can do that at sales@practicesuite.com. You could also call us at 510-284-2425. Thank you very much for attending today. We hope you have a wonderful day.